Our next question, and I'm going to actually put this question both to Sasha on one aspect and then the group on another. So the question is, what guideline support are there for teaching assistants or staff who will need to work one-to-one with children, often in close proximity? So if I can put that to John and Helen and sort of Duncan. But Sasha, I wondered if you could actually talk to the sort of question about what about the support for staff sort of for mental health and sort of social and emotional well-being in this. So I'll come back to Sasha secondly on that one, but can I ask?
How we do. Yeah.
Sorry, John and Helen, is that you giving an answer? What guidelines of support are there for TAs or staff who need to work one-on-one with children, often in close proximity?
And I think
we don't know.
Yeah. So we can give you our experience here, but it's different because so what we've done here in the trust at the beginning, we had we sort of divided children into those we thought were infected and those that we thought weren't. We did that for adults as well. And we very quickly realised that actually we just had to presume that everybody was affected and be cautious with all. Because I work on what we call the red wards, the COVID wards, I do wear PPE for any child. And that has got obviously the benefits of me being protected. Being very honest, it's brought some real challenges as well. There's challenges for us as staff members. Having the masks on all day is really, really intense. But it's also extremely difficult to get that relationship with the child. So when we're in an environment that we really, really can't have that mask off, we've had photos of ourselves so we can show who we are normally and hold them up by our face, and the children have interacted with that. What I tend to do if I've got a child where I'm one-on-one in a clinic room and I'm needing to get that rapport to get what I need from that relationship is I socially distance, and I make sure that I've got, sometimes I do show them a face just to settle them down. That's slightly, that's a balance of risk again. But it's a little bit different in the environment. I'm seeing them when they're ill. So maybe, Duncan, do you have guidance? It fits in a little bit with the discussion about face masks overall, doesn't it?
Yeah, I mean, it's a difficult one. I think the most useful bit of guidance is if you have a look through the one that the government released about special schools, because that takes the approach of there's going to be more children where it's difficult to keep that 2 metre gap. And it just talks about that balance. What Helen's been talking about is that, you need specific situations that you would have needed PPE before. If there's aerosol generating procedures going on as well, you definitely need PPE. And if you've got a symptomatic child, you need PPE. But it's a sort of 1 metre plus rule now, so it's just about trying to minimise that risk, I'm afraid. But the special skills guidance is probably the best one to try and help make those judgments.
Right, thank you, Duncan. Okay, so can we go to Sasha now? And Sasha, could you talk about the social and emotional well-being of staff, who I think we've got to recognise have been under huge pressures and likely to be under huge sort of pressures this next year?
Absolutely. So I think one of the things that we have put in place for staff members and for everyone is the access to support via our guideline. So our guideline, which is it's a telephone support line, and it's open from 12 p.m. to 12 a.m. every day of the year. The phone number is 01274 594 594. And that can provide some support for staff members, but also put them forward to our counselling collaborative, who can provide just somebody to talk to. And it might be one-off conversation that you might need, or it might be that you need some further support, and they can provide that. So that's been put in place in the last couple of months. So what I will do is, yes, I'll put the information in the box in a moment, and so that's that support immediately. And the other support that's available is then via our Healthy Minds Services portal, and that can provide, if you're Bradford based, it will provide you the support that's available in Bradford, and I'll put the address for that below as well.